good morning or good afternoon from Madrid, no?
Yeah, from Madrid. Great to have you. We never actually met officially.
We were going to when you
Yeah,
visit Seattle in
yeah,
summer, but I was
yes,
in Argentina,
exactly.
so I miss
And
you here. Yeah,
but I do feel like I know you because I know your work so well that it's a pleasure to finally meet you.
it's my pleasure to finally talk with you.
Yeah, it's gonna be super cool to be together in Miami.
I think it's a great opportunity to see you and John, both key leaders in dentistry
Yeah.
together. That is not very frequent, so it's a great opportunity for everybody.
I think so. I think as you know, you've been working with John lately very, very much, and I've been interacting with John Kois for so long. Unfortunately, he's not going to be eternal. I wish he could.
Nobody.
Yeah, nobody is. And he is slowing down his lecturing. And I think this is a very unique moment because I don't know how many times he's going to lecture outside his center the next few
Yes.
years.
Well, we have 2 years of waiting lists at the Kois Center to do a
Yeah,
course, the core
yeah.
courses. So
Hmm.
it's a great opportunity because if you want to do a course at the Kois Center, you have to go through the waiting list, which is
Yes.
2 years. So it's the busiest. We are very busy at the center.
And you should, and you deserve to be busy because I think it is the best comprehensive course in dentistry, and I think every smart dentist should do the full Kois program. That's what I believe.
It's a
And
very unique
yeah,
program.
and now with you together in the team, when did you join the team?
I joined 2021,
2020.
so
Okay.
getting to the fourth year, getting
Okay.
towards the fourth year.
Uh-huh. Uh-huh.
Time goes very fast. It looks like
Yes,
yesterday.
time flies, but I can say, John is smart, and bringing you on board, I was like, wow, that was a great move. It's a great combination between your skills and his skills and experience.
For me,
It's
it's a great opportunity.
Yeah.
Mhm.
Actually, I have to be honest. The reason why I created this event with me and Kois, the reason why I thought about it happened because you were working with him.
Really?
Yes, yes, because you know, when I saw that you were joining him and working together, that was a moment that I said, okay, this is John Kois reinventing himself once again. This is John Kois being open to what is new, not being stuck on an old way of doing things. That is his natural, beginner's mind, always learning, always wanting to learn. He always had this behavior, and that's why he's one of the greatest. And when he invited you to join him, for me, it became clear that he was embracing full power, everything that technology can bring um, to dentistry, right? And because of that, I thought about why not creating a course to show this new era of the Koi Center, right? Why not show to the world that um, the Koi Center is embracing all these new strategies, but with this huge scientifically based foundation that he always had, and you are bringing from the digital perspective. Um, the first name that I suggested for the course for John was um, Kois and Coachman digital reality. I wanted to discuss the digital reality. I wanted to cut the BS. I wanted to show what works and what doesn't, what is marketing and what is efficiency, right? Effectiveness.
Exactly. Mhm.
What is nice on the slide and what is actually nice daily with the patient. And if you are not part of his team, I would never imagine that this discussion would be possible, you know. So that's the reason why I say for sure, you know, that's the reason why this course exists, is because you joined John at the center. And I think I'm gonna literally, and we can continue to just chat here casually as people are joining us live from all over. We're gonna go over, we have some very cool topics that we want to discuss on this specific session, but this specific session here is to show the potential of joining us in March in Miami, right? Where John Kois is bringing his experience, but bringing the best of his team with you, Marta and Dean. And I'm bringing two of the best experts on digital that I know in the world, for sure. So among Vicente and Vinicius and you, Marta, I don't think people can get more digital knowledge in one place, in one shot, as they're gonna get in Miami in March in this course. So
I agree. I think that you explained it very well. Like the representation of what the Kois Center means is an evidence-based digital dentistry. The concepts doesn't change, it's just the tool. So I think that we're going to have an honest presentation of what we can do with technology, or in other words, how we successfully implement digital technologies in our practice. Because not everything works.
Yeah, and implementing is a key. So there's a couple of words that the older I get, the more I love. Implementation, effectiveness, pragmatism, scientifically, but also clinically proved solutions. Meaning, I love to talk to people about a topic. I love to talk to people that are doing a lot of that topic, right? The amount of people lecturing about topics that don't do a lot of that topic is too much, right? You see people teaching things, and when you go see them work, you realize that they are not actually using that much, right? They did a few cases to build a presentation. And in your articles, you've been really very, very smart and efficient on trying to show people the reality, right, behind the glamour of digital solutions, right? The reality behind it. That's why I wanted to call the course Digital Reality. John said, no, let's go beyond, let's go clinical outcomes, because that's the ultimate outcome that you want to achieve with digital. You want to know, how can this new gadget can help me with the outcome, right?
Exactly. I think that technology will only stay in the market if it gives us an advantage, right? If we make us faster, or if we have a better outcome, at least the same outcome. So I think that that's what we need to understand. We need to understand the concept, and then depending on the system that you have, you will apply it differently. And I think that is one of the keys that we're going to go through.
So it's basically, we're going to have and I'm going to play the moderator to try to take the best out of all of you guys, because you have so much know-how and knowledge and experience. What I usually say is that as clinicians, we don't necessarily need to love technology. We need to leverage technology. We need to take advantage of technology. Technology needs to make our life more easy, not more stressful. If technology is complicating things, don't use technology. Don't use that specific technology. So the key is to understand everything that is coming to the market. There's so many new solutions. There's an access of opportunities and solutions and technologies and gadgets and equipments and things. It's impossible to know everything. It's impossible to use everything. It's impossible to implement. So you need to first pick your battles, right? Choose which technologies can help you the most on the type of dentistry that you do, right? And then choose the right moment to adopt that technology, because if you're too early in, You're going to suffer with the early adopters. You're going to suffer with the beta testers. Some people love that. Some people just love being the first and struggling, right? The guys that bought scanners 10 years ago, right? Scanners were not ready. It was a nightmare. And a few people just enjoyed, you know, being among the first ones. But I don't think most clinicians are there. Most clinicians are very pragmatic. They want to know, is it good enough for me to use today, right?
Right. Plus, like, let me give you an example. At the center, if we talk about intraoral scanners, that is normally the first technology that we buy as dentists, because it's the first way to capture information from our patients.
Yeah.
We did a study in 2021 with the American Dental Association, and we measured the market penetration of intraoral scanners in the US. And the outcome was 54% in the US. But at the center, we did our own study. We have 98% of the dentists that come to the center, they have one scanner. But we have a new tendency that we are seeing. 48% of the dentists that come to the center, they have more than one system. Because we understand that one system could be better for specific applications and another system for another thing. So that's what we are seeing. We need to have, depending on what you do in your practice, you may need to have different systems.
So at the end, you know, I love to talk about scanners with the outcome in mind, with your focus in mind, you know, because it's not one fits all nowadays. There's so many things that you can do with this technology that the best way to start the discussion is not what technology to buy, but what area of your treatment that you want to improve. What area of your treatment that you want to improve. Because the discussion needs to start first, even should I do this little step with or without technology? And then if technology is an option, what are the technologies available? Which one fits to my style according to your specific pain points? I love talking about technology by starting with the pain points discussion. Where are you struggling? If you're performing something so well and so efficiently, why do you even consider buying technology to do that, right? It's going to add an extra factor there. So I really want us to bring the discussion about technology from and approach it from a different perspective. And I think it's going to be a lot of fun because you guys have so much experience from the scientific side and research side. You talk about evidence-based digital dentistry. Give me a definition of what does that mean.
That means that whatever you're doing in your practice is going to be predictable and the outcome, it's good, proven. It's not like random, because that means that it's like throwing a coin with our patients, and we cannot afford that in our practice, right? So we want to do any intervention with any technology that we know that it works. So it's going to work all the time with our patients.
And you've been doing this homework yourself, and that what you guys will give in this course is the shortcut, right? Because you can do what you did for the, I don't know for how many years you've been publishing about digital technology, but I don't know, almost 10 years that you've been publishing.
Just 7 years.
7 years. You're going to give people the shortcuts, right? Because people can do this individually. If you buy a system, if you buy a technology, or if you analyze a certain procedure and you say there's a technology here that they say is good for this procedure, should I invest on this? You can go by the feeling, like most dentists do. You know, I have a feeling that this is good. I have a feeling that this may help. You know, I have a friend that said it's good. Or you can just do all the tests and research and you know, and literature review about it and call your mentors and masters. It's a lot of energy. And you guys already did this job, right? And you're willing to share with people that, right?
We did not all the research we do. We did a lot of research. We read a lot of papers every month about digital. We have many articles published at every minute. Imagine in digital. So we reviewed them all. We did a summary, but the most important thing is we create evidence-based workflows, the protocols that you need to do. Our research is not because we love to do research. Our research, it's aiming to answer questions that we have in the practice. Is when we want to use a technology, what do we do? And then when we start working with it, we have questions. So we did the research to answer those questions. So all our research, one of the requirements for John is this needs to be applied in our patients tomorrow. So when we teach something at the center, has some support and evidence. So we know that it works.
So you connect both worlds. You connect the science, the researching the science behind. Does this make sense scientifically, first of all? Then, does this make sense clinically, right? Then you mentioned something else as well. Most solutions are analyzed in a fragmented way. And you guys are connecting the dots into a workflow. And that's what we do over here at DSD. I tell people, technology means nothing. A technological tool means nothing if it's not inserted in a proven workflow. You know, your scanner needs to be part of a workflow. The scanner itself is not the whole workflow. You need to have a workflow that starts before the scanner and continues after the scanner. And you need to imagine this before you invest on the scanner. Otherwise, there's a big chance you're going to underutilize that technology that, by the way, is very common, right? Dentists buying stuff and underutilizing
that
stuff.
Happens a lot. Yes, I have this question every day at the center. Marta, what scanner should I buy? Every day, hundreds of times. And I always answer with a question. Who are you? Meaning, like, what kind of dentist are you? Because it's not the same if you do a lot of ortho or a lot of pros, but it's general, like small cases, or if you do big cases, how many big cases a month? Because it needs to make a business case when you invest in this amount of, in the technology. And the other thing that I've seen in the center is when I start giving a lecture about intraoral, all of us, let's be honest, anyone can obtain an intraoral scan. It's not that difficult, right? So when I start giving the lecture, everybody says, like, what is she going to show me? I know how to scan. But after 10, 15 minutes in the lecture, you can see the faces like, oh, I didn't know that. Oh, nobody told me that. And at the end of the class, all of them, not all of them, but the majority of them come and say, oh, I didn't know what I was doing. I had no idea what I was doing. So I think that is something that we will address in Miami as well. There is a lot of factors that we need to know to maximize the outcomes of our systems.
So you mentioned we need to become the user 2.0. What do you mean with that?
That's right. The user 1.0 is the one that has low experience. So you believe everything because you are starting with the technology. Super cool. Everything works. I can do full arch implant cases, no problem at all. But then when the more experience you have, you see that not everything works. And it's not predictable 100% of the times unless you know what you're doing, right? So you need to become the user 2.0. You need to have evidence-based digital dentistry. You need to know what works and what does not. So whatever you do with your patients is predictable.
Completely agree. That's we are not anymore on a phase of convincing people to use digital. That part is gone, right?
Totally. It's already assumed. Yes.
I remember this day. But now it's about how to become a digital expert, right? How to really master this technology, how to leverage completely this technology. As I said, many times technology is underutilized because people are not understanding how to connect the dots and how to create a seamless workflow. The other problem is that people using technology many times technology is not running smooth, so they don't use it for every patient. So it doesn't become a routine. It's an exception, not the routine. Do you see that as well?
I see that many, many times. And it happened to me in the beginning when I was still living in Spain, and I worked with the scanners. I didn't know why it was working with one patient and it was not working with the next one. So at the end, it was like in a corner full of dust. And I say, like, this is a lot of money. It doesn't make sense. But that was a long time ago. Now we are in 2024. We have more evidence. We have more data. So we actually know what is more predictable and what you need to do to have a good outcome. I think that's the difference. And I think that's why we are not in the early adopter phase. we are maybe in the laggard, like meaning like the people that is adopting the technology even late. Because with intraoral scanners, we know that it works. You know, we have data. We have more big cases that it could be tiny bit more challenging, but you can do a lot of interventions in a predictable way.
Yeah. And as more people are joining us, I just want to mention I'm here today with this amazing dentist researcher, Marta Revilla, that is probably the #1 publisher, author, researcher in digital dentistry. I don't know another person that has published more in digital dentistry than you. Do you know somebody, Marta, that has published more than you in digital dentistry topics?
Well, I work with a lot of people, you know, so it's a teamwork.
It's a team. Yes.
It's a group of people working together. We try to do, as I said, the most that we can, but it's basically because when we work with patients, we have a lot of questions. So we try to answer those questions by doing research.
And how many articles did you publish about this topic, about digital dentistry in general? Do you know the number?
230 something.
Okay. So just to put some numbers in comparison for everybody, I think I published 40 plus articles in my career in all topics that I talk about, right? And Marta, more than 200 specifically on digital technology, digital dentistry. That's the reason why John Kois invited her to join his team. You know, John, I can only imagine at one point, you know, you said you joined the team in 2021. I can imagine 2019, 2020, John thinking about, you know, I cannot stay behind. Digital is a reality. I need to move into digital. Who is the person that I want beside me? And I can only imagine him thinking about you. It needs to be this Marta girl. She needs to come and work.
Oh, you're very kind. But do you know the story of how I finished working at the center?
Tell me.
I was at that time full-time faculty in Texas. And one day I got an email from John saying, "Hey, Marta, you have an error in your article. One number doesn't match in the results paragraph versus the table. Which one is correct?" And I thought, wow, if John Coy says that it's an error, it should be an error. So I checked the article and then I emailed him back like, yeah, I will correct it. And then we started doing Zooms. So every Sunday morning I grab a coffee. I was in Dallas, he was in Seattle. And then we start doing meetings, talking about dentistry, technologies. My husband one time said like, "Who are you talking with? Who is that dentist? Like Sunday morning, you're having a coffee with him." Like, no, he's a great dentist. Don't worry, I'm learning a lot. So we started doing projects together. And then one day I got a possibility to start working as a director of a program in one school. So I called John and I said, "John, I have no idea what to do." So I just explained him my life and I told him whatever I was thinking. And he's like, and then 3 days later, I got a text from John saying like, "Hey, Marta, I want to talk to you." And I thought, another project. And then he offered me a job. So yeah, it was a very interesting way that we start talking.
That was such a smart move, I can say, from him, and then from you accepting this opportunity. You know, I usually say John Kois is the most important dentist alive at this moment in time, in my humble opinion, right? He
is amazing.
Yeah.
I feel very lucky, and for me, it's a great opportunity to learn with him, to work with him. He's just an amazing person and a dentist, obviously, but he's always open-minded.
Yes, that's what I noticed when I remember the first time I met him, you know, many years ago, and he was watching one of my first lectures, and he was so kind and supportive when absolutely nobody knew me. And he was extremely open and curious. You could see that he was curious, asking questions like, "Why did you say this? Why did you show that?" You know, but not trying to bring you down, but trying to learn. He was like, "I want to understand your thinking process here because I think this is interesting," right? So since then, I became a fan. And that's why I was cheering when I heard that you were going to join him and work with him, because I say, yes, this is going to be amazing for dentistry. Both of you working together, only great things can come. And I think that this event in March in Miami will be a big moment to showcase everything that you guys been doing together, you know.
Totally.
Yeah.
We're going to do a presentation together, John and myself. We're going to go through digital occlusion, which I think is one of the hottest topics today.
Yes.
What do we know about occlusion? Even like
Yes.
digital, so imagine.
Yes.
So
Yeah.
we are going to go through conventional, and then we will go through, and then we will finish it with the latest technologies and what you can do with those technologies.
What is worth investing in, what is working. I'm going to be there sitting, learning, and asking questions. I'm going to play the devil's advocate. You know, I'm going to make tough questions.
I like the plan.
Yeah, because I know you guys have answers to all of them. And one thing that I love that John always does, and you guys are doing it together in the digital environment, it's basically reading everything that is available and filtering, right? John always did that.
That's right.
He was always reading so much and gathering all the information, cutting the BS, eliminating the excess, and filtering, distilling what really matter, and then giving the conclusions and the summary to his students, right? And I remember him doing that on his courses, but doing on his annual symposium, he had a whole session on that, where he would just say, okay, let's see everything that came out, and let's see what is relevant and what is not. And and you guys are doing
That's
that.
what we do.
Yeah, you guys do that in the digital environment. That is so needed, because nowadays it's so easy for people just to create something, do a few cases, and publish an article, right? It's so easy to generate content. Nowadays, people
No, please, sorry. I was trying to say, like, there is a lot of smoke. Like people with Instagram and social media and case reports. So there is like a lot of smoke. You don't know what it works. And, you know, just because you did a case doesn't mean that it's predictable all the time. So yes, we read 20 articles every month. We read them all. We select the articles that we believe they are very well done. And then we do a summary at the end of the year. And that's how we keep ourselves updated. And with digital, that's what we do. And for me, it's very fun. But there is a lot of articles, a lot of things.
That is already worth it. Just that is already worth it, coming to Miami to join us just because of that, you know, listening to this summary. Because, as you said, social media articles, right? Everybody's publishing and creating conclusions. Say, this works, this doesn't work. And you have nothing to really help people understand what is behind that conclusion, right? And the fact that it's so easy nowadays to generate content and to make some nice pictures and share ideas. What is good? There's a good side on that, but there's the downside, because everybody's overwhelmed with information. And the problem is the access is too much information. So if you are a restorative dentist and you want to do, you want to rehabilitate smiles and you want to leverage technology, you guys will bring exactly what is needed, what makes sense, and what doesn't.
And another important point is that we will show in Miami is that we are multi-brand. You are not going to go and learn just to use one manufacturer, because it doesn't matter what technology or system or what is your manufacturer. You need to understand the concepts, because in Miami, we may have people, you know, different kind of users. It doesn't matter. You will learn how to maximize your technology.
And you know what? This is something huge about John Kois since ever. You know, he was always commercial-free education. We know how hard it is, because me as an educator, as a speaker, as a teacher, teaching became my main job, my main thing. And I did have deals with companies, you know, in certain moments of my life. John Kois was always completely away from all of this, right? He was able to create a lecturing career, a teaching center that was completely non-commercial, meaning every company could give him equipments, any company could help him test their equipments and materials, but he was always open that he would show everything, right? And coincidentally, I'm now, me, myself, in a moment in my career that all my exclusive commitments ended simultaneously. And after several years, I'm completely free to talk about anything that I want. Anything, absolutely anything. So, of course, I was always very honest and fair on stage to show people my real opinion and which companies were supporting me. But it really gives you a powerful position when you have no strings attached and you can say whatever you want. So as I said, I'm going to play the moderator, I'm going to play the devil's advocate, and I will make sure that everybody knows that I have absolutely no connections with anybody, and you guys as well. So we're going to be completely free to mention everything and to give what we really think to people.
Exactly. I think that is super important today because we don't have influence in anything that we say or in our research, in our experience. That is very important. At the center, we try to have as much technology as we can because we have people coming all over the world that they are different kind of users. So we have 10 intraoral scanners, we have 4 jaw trackers, we have 5 facial scanners. We have so much technology that I used to joke like this is like NASA. We have so much technology, but it makes sense because we need to test it. If you come to the course and you are a specific user, I need to be able to answer. And not all the technology it's handled in the same way. So I think that is one of the strengths that people will see in Miami as well.
No, and we're going to combine this experience because here at DSD, we have a similar situation because I believe that nowadays, you know, a company, when they come with a new product and they are brainstorming about how they go to market, how they promote, how they create awareness, I'm sure that one of the first places that they think is the Kois Center. Say, we need to get our product at the Kois Center. You know, we need to have Kois and the team evaluate, you know, tell us the truth, what they think about our technology, our product, and so on. And it happens the same here at DSD. Probably the second name that they come, you know, it's like, no, and we need to convince DSD to use it and test it as well. You know, we need to see if Christian likes that equipment and can talk about it on social media, etc. And we need Marta to create a research about it, and hopefully she can publish an article and hopefully have some good conclusions about our product. So if I was a big technological company owner, I would probably think like that. I need Kois to test it, I need Marta to publish it, and I need Christian to talk about it on social media. If we can
it's a triangle.
If we can combine these 3 things, we have a good chance, a good go-to-market strategy, right? So we've been exposed to a lot, right?
Yes, I think it's super important. And the most important is like we have the technology, we have tested, we use it, and we will show how you can maximize that in your practice. Again, that is one of our goals that we have for Miami.
And I'm writing down all my tough questions to ask them, and it's gonna be a lot of fun. Do you know the 2 dentists that I'm bringing with me? Have you ever heard about them? Do you know them?
I don't know them.
Vicente Jimeno is also from Spain, and you're gonna love to meet him because he's like I would say a digital version of Kois in terms of an encyclopedia. You know, he reads everything and he tries everything, and basically by himself. I don't know how he does it. You know, he's an amazing surgeon, periodontist, dentist in general. He's been one of the top clinicians in our DSD clinical courses, and absolutely any question that I have about digital and new products, I call him, and he always has an answer. So it's gonna be, and he, just to see how hard worker he is, and he's an amazing student, right? He's always learning. And when I invited him, I said, look, John Kois is bringing Marta on his side. I need to have somebody at the same level on my side, and I'm inviting you. And he was like, oh my God, I'm so honored.
No pressure.
He knows you very well, and he knows your work, and he is studying all your articles from A to Z. He said, I'm reading all of them, I'm summarizing all of them, I'm highlighting all the conclusions, I'm writing down all my questions because I want to be ready to meet Marta. So you're gonna love to meet Vicente.
I'm looking forward to it. I'm sure that we'll have nice discussions.
Yes, and we're gonna make them live, and we're gonna make them. Of course, we are doing our homework to prepare the course and prepare the structure of the content. But as I told John, I say, John, we're gonna have room for improvisation. We're gonna have room for open discussions, and we're gonna have moments in the course that we're gonna be literally having a conversation, maybe even with a glass of wine.
That is very engaging, and it's
Yes.
actually very interesting when you have those kind of conversations out of the lecture. I think that is where you can have a nice learning value as well. And John told me that every time that you guys get together, you go beyond. Like, you interact very well. You have very deep discussions that was not even planned for.
Yes.
So, he talks very highly about you. So we are very excited at the center, to be in this event.
No, it's the best compliment for me. It's to have any kind of comment coming from John. Actually, just to have him accepting the invitation to come and do this event was like, it's amazing. As we discussed at the beginning, I believe the dental world shouldn't miss the opportunity to listen to John, as he is slowing down and lecturing outside his center less and less. Maybe that's the last chance outside the Kois Center, one of the last chances for sure. The waiting list at the Kois Center is more than 2 years. So basically,
That's
if
right.
you want to listen to the biggest living legend in dentistry in the world today, coming to Miami is your chance. And on top of that, you're going to have Marta, you're going to have Dean, you're going to have Vinicius, you're going to have Vicente, and you're going to have me moderating the whole session. So I'm really excited. I'm really smiling to myself when I think about the event. And I'm sure everybody's going to have a lot of fun. And we're going to have an amazing social event afterwards, beautiful happy hour where people will be able to really connect and network in a social environment. We're going to have a beautiful pre-event dinner with some of the participants that register at the VIP ticket.
That's right.
Dinner as well. But anyway, I just want to thank you, Marta. First of all, thank you for everything you've been doing for dentistry and all your work, for digital dentistry.
It's been my pleasure. For me, it's an opportunity. It's learning as well. And working with all the people that we work with all over the world to develop all those research has been a pleasure. So hopefully we keep doing it for long.
Yes. So you're going to be on stage, I know, as you are a team player. You're going to be on stage representing a lot of people that helped you for so many years to create this content. There's not even one Congress in the world today that doesn't mention your work, that doesn't mention the work of your team. So congratulations for everything. And
thank you.
And thanks for joining us in Miami. And
it's my pleasure.
I'm really looking forward to meeting you in person. Finally, I feel like
Me too.
I know
finally.
you. I see your picture everywhere. I read so much about you. I read all your articles. It feels like I know you. This is actually the first time that we are connecting virtually in real time. And Miami is going to be the first time that we're going to meet in person. So an extra reason for us to enjoy that event.
Yes, it's going to be amazing to see you and John working and talking and having those conversations. The content is really great, and we're going to have an honest view of what we can do with technology today. And if you allow me, it's going to be fucking great. Not
great.
Event is going to be
epic.
the same.
Fucking epic.
Exactly.
Fantastic, Marta. Thanks for joining us on this quick webinar. I hope the listeners enjoyed our little teaser here. And I really hope to see some of you with us in Miami. The course is getting full. We have a great group of people coming. Elisa from Forum Labs joined us here. Elisa is saying hello, and thanks, Elisa. Always super nice. Maybe you can join us in Miami as well.
Thank you, Lisa.
So thanks everybody for joining us. This we're gonna also post this discussion, this little chat on our social medias as well. And if you're thinking about coming, spread the word, because this is a unique opportunity, as I said, to not only learn everything you need to know about digital to become an advanced digital user, but also hear us, all of us, interacting with the most important dental professional that I know in dental history, Professor John Kois. See you guys in Miami.
That's right. Thank you.
Ciao, Marta.
Ciao. Thank you.
Bye-bye.